Good morning. Happy Monday, everyone. I hope you had a great weekend. Good morning. So, did everyone enjoy their weekend? We are back Monday morning, bright and early, ready to go. Good morning, Kathy. So I have all three dogs out here with me today. Hopefully they will stay quiet. It's really hit or miss. Two big bloodhounds and a little bulldog, and my kids are running around out there. So if you hear barking, I guess I didn't get a haircut. I didn't, but I flat ironed it. So that's why it looks different. But thank you. I mean, I guess I got a little bit of a trim, but nothing fancy. Good morning, good morning. Good morning, everyone. So nice to see you all. We're going to be talking about something that might seem a little bit out there today, but I think that it's worth talking about. I feel like there's a lot of alternative therapies that are immediately shut down by medical practitioners that maybe we should just keep an open mind about. And one of those is something called resonance repatterning. So I want to talk about that today and some of this success that's been seen, what it's based on, so that you can decide whether it's something that might help you. I don't know if any of you have tried resonance repatterning. Anyone? It's kind of based on kinesiology. So of course my dogs are walking by. Come here, Hank. Come here, Hank. Can you sit? Sit. Good boy. All right, you want to introduce yourself, Hank? Yeah? Yeah. There you go. There you go, Hank. A lot of you may know Hank. He used to go to the office with me, so Hank was my office dog for a very long time. So there he is, pacing, and Piggy likes to pick on him. So hopefully they will lay down and we can chat about this interesting topic. Now, this is not anything that I am trained in. I don't know how to do resonance repatterning. It's something that I would refer out for, but I do find, and when I first heard about it, I'll be honest, I was kind of like, I don't know, but at the same time, anytime there's something that is low cost, that is non-invasive, that can benefit a body as a whole, I try to always keep an open mind about it, okay? So this is one of those therapies, and I just want to call your attention to it. There, they finally laid down. Yeah, he is gorgeous. He's a gorgeous dog, and he knows it. He totally knows it. Piggy rules the roost, however. All right. So let's talk about it. Have you guys heard of resonance repatterning, or is this new to all of you? Anyone try it? Anyone aware? I do have an article at drpingle.com on it. There are some links to practitioners as well. So if this is something that sounds like something that might work for you, check it out. Okay? So this discipline is based off basically the connection between our emotional health and our physical health. So many of you may know that emotional pain can cause physical pain, and physical pain can cause emotional pain, right? Makes sense. I mean, if you're not feeling well about yourself and your neurotransmitters are off balance, that can have a physical impact on you. I mean, we talk about this a lot with stress, right? When I talk about running from a bear and the way that stress impacts the body, that's an emotional or an outwardly stimulation going in to cause physical symptoms. It's the same thing. And the opposite can happen as well. You could have physical pain and be so upset about it because you can't do your normal everyday stuff due to pain that it causes emotional depression, right? There's a connection between our mind and body, and typically in medicine, physical symptoms are looked at as physical symptoms. You do labs, you do, physical exam, and if nothing comes up, it's like, oh, well, you're okay. Or you have back pain, here's your pain medication, right? But a lot of the times by addressing the emotional pain, you can also address the physical pain and vice versa. And that's what this therapy does. Piggy, don't pick on Hank. These dogs, I tell ya, good girl. All right. So this is where resonance repatterning comes into play. Okay, this is an emerging field of alternative therapy. Okay, and it focuses on clearing negative emotional patterns that cause physical symptoms. Now, one of the most common physical pain syndromes is chronic fatigue syndrome or fibromyalgia, those two, right? What is their main treatment? Antidepressants, right? Why? Because there's an emotional component to the pain, right? Same as IBS, with irritable bowel syndrome, a lot of the time it's treated with antidepressants, right? There's a strong link. It's pretty well documented that the mind and the body are related, and that a lot of the treatments for physical symptoms come from the mind and vice versa. So this is just tying into that. It's just a different way to go about it. It's clearing physical symptoms. Now, we've talked about Reiki in the past and moving energy through the body and how that can release pain and syndromes as well. So this is kind of a similar type of discipline. Just think about that. How often do we simply focus on the physical symptom, not consider the emotional pain and stress that caused it to begin with, and then that physical symptom returns or doesn't fully go away, right? Okay. So resonance repatterning, and I know I'm going to trip over that, that tongue twister today, is an alternative therapy rooted in the belief that you can self-heal by clearing negative beliefs, negative behaviors, and emotions from your life that are inhibiting you from living your best life. Now, we're seeing this a lot right now in our society, a lot of negative energy, right? I'm being asked about EMDR. Similar type of idea behind that, different mechanism. Right? But it is linking the emotional and eye movements and things like that to physical pain for sure. There's a lot of negative energy floating around, right? And if you play off that negative energy, it can actually cause physical symptoms. If you think about something that really upsets you, you can create heart palpitations. If you think of something that really upsets you, you can get really tired, you can feel nauseous, you can lose your appetite, right? Our brain controls how we interpret information. So we have a lot of that going along right now, all this negative energy that we really need to clear. So this is rooted in fundamental physics law that all matter is energy and that all energy has a frequency. Okay? Resonance repatterning practitioners believe that each person has a certain frequency that correlates with specific events or circumstances. Okay, so we all resonate. It's based on a physics law of resonation. Piggy, stop. These dogs, I tell ya. All right, come here. All right. Okay. So as a result of this physics law, this repatterning is based off the fact that what we resonate with is what we attract. Okay? Have you guys heard that? The energy we put out there is the energy we get in return. So if we put out a ton of negative energy, we get negative energy back. If we're attracted to a certain type of person who's not a good influence, we're going to get that back from them, right? What you resonate is what you attract. And that's why the idea of positivity and sending out positive messages actually attracts positivity. She's the instigator. She is. You're the instigator, aren't you? Yeah, she's also thinks she's the alpha, and she's the smallest dog of them all. This is Piggy. I think a lot of us recognize that if you surround yourself with negative people, you feel more negative. But there's actually something you can do about that. Maybe you didn't realize that. I just attracted a Frenchie. I did. Yes, I did. This is why I love pets, right? They bring a smile to your face. And I did attract a Frenchie. We'll see if she sits here for a while. So basically, you resonate with what you attract. What you resonate with is what you attract, and you will experience these events or circumstances throughout your lives until you change the frequency, right? So it's up to us to change the frequency of the energy that we're emitting. Does that sound crazy to you guys? It's a little out there. And I think a lot of doctors kind of dismiss this as a possible therapy because they're like, well, I don't know. There's no physical way to measure that energy, although I'd like to argue there is, but it's a bit different, right? It's a different therapy out there, but I want you to be aware of it, okay? So basically the premise is, if you're experiencing any limitation in life, let's say some sort of physical symptom or some sort of, any health concern really, it's because you're vibrating at a low frequency due to unconscious patterns that occurred earlier in your life. We learn these patterns as we go along, right? And those patterns create who we are and create the energy and the frequency that we resonate at. If that makes sense. Do you have something to say about that, Piggy? Yeah, okay. So if you think about it as like a mind-body connection, how you feel impacts your physical health, and it can manifest in many different ways. For example, if you're experiencing anxiety or fear or anger, you're not likely to feel great, right? And then all of a sudden you start to feel stomach aches, or you feel tired, or you just don't feel yourself. And that's what this is based on. I have a question, Jamie Lynn. So someone can give off a negative vibe and then you feel a negative vibe. Yeah, absolutely. Who you surround yourself with and the energy that you give off attracts the same type of energy back. I think most of us have recognized that. If you walk into a room like with people you don't know and it's kind of a negative energy, you don't feel great. You walk into a room and people are uplifting and positive, you feel great. You want to stay, right? But if you walk in with your head low and down and not feeling great, the people that have the positive energy are not necessarily going to be attracted to you, right? It makes sense. As I look back on my worst health conditions, I can relate them to a depressive part of my life before the hospital visit. Yeah, absolutely, without a doubt. So the goal of resonance repatterning is to help you identify any unconscious negative patterns that you may resonate with or be drawn to due to some earlier experience in your life. Now, you see this with trauma quite a bit, right? People that have had trauma tend to attract people who cause trauma, right? It's an energy repattern, right? So you can actually change that if you pay attention to it, okay? You can essentially reprogram yourself to a different energy and a different, frequency, if that makes sense. Okay? And as a result, that worry, that fear, that pain, and the illnesses that were associated with that negative pattern actually get better. Okay? Without medication, right? Because you're changing the repatterning. Now, could there be many facets to this? Could there be a physical symptom that requires additional treatment? Of course. But it always helps to pay attention to that mind-body connection. I cannot stress that enough, especially in the times we're in right now. Okay? There is a lot of negative energy. And if you're putting out negative energy, if you're someone putting out posts that cause negative energy or that promote fear, you're going to get it right back at you, right? So a lot of people ask, why do I stay positive during this time? There's a lot going on. Oh, I must have nothing impacting me. Of course I'm impacted by this time. It's freaking hard, but it doesn't help me to perpetuate fear, anger, and negativity. It just does not help, right? I want to continue to attract positivity around me, so I have to put that out. Are you done? Are you done being positive? Yeah. You want to be put down or you want to sit? Let's see. Okay. Advice from a Frenchie. It's been a while since you've been on camera. So how does this work? I know it sounds too good to be true, but let's talk about what it is, how this is done. So first of all, it is done by a certified practitioner. I don't personally do this therapy. I'm not trained in it. I've seen the benefits of it in patients for sure, without a doubt. I've read about it, I understand it, and I definitely recommend it. Not something that I'm trained in, so I have to look for certified practitioners that can do that. Now, I do have in this article, I do have a link to certified practitioner directory so that you can check it out. Okay, if you can't find someone. Often chiropractors are trained in this discipline. So it's based off of applied kinesiology. Have you guys heard of that? Which is essentially muscle strength testing. So basically the belief is that certain muscles are linked to certain organs, glands, and energy pathways throughout the body. So if certain muscles are weaker than others, and we're talking about comparable muscles. Okay, I'm gonna set you down, big girl, okay? Can you be a good girl? You're getting heavy. There you go, good girl. So for example, you test the muscle and then you either state something, or sometimes people do it with supplements or medications where they hold it and then you test again. And if the muscle gets weaker, that means that it's not aligning. The resonance, the energy is not aligning. Okay, so it's kind of crazy, sounds kind of out there. It definitely takes some training, but it's belief that these energy pathways are linked to these muscles. And so by doing that, you can find the imbalances in the body and correct them. Okay. Now, according to the Professional Association of Repatterning Practitioners, these practitioners use applied kinesiology to help identify the patterns that are limiting you and the patterns your mind and body are ready to let go. So we always want to let these patterns go. I think that's always a desire, and we all speak that we want to let things go, stop worrying about this or that. Our body wants to let it go. It does not want to hang on to it. And the reason why, a lot of the times, I guess the theory is that you're getting physical pain or physical symptoms because your body can't let go. You're not allowing it to let go. If you let it go, it clears that energy pathway, right? So that's kind of the premise behind it. Our body does not want to hang on to that trauma, fear, negative. We do not. We want to run from the bear and we want to move on. That's what we want to do, right? And a healthy body can do so. Okay, I'll come back to some of those questions there. Hang tight, okay? So they do this typically by making certain statements and then using applied kinesiology to determine how much a specific statement resonates with you. So some of you are saying that you've done this with your holistic practitioner, maybe with like supplements where they say, okay, I'm going to test your muscle and then I'm going to have you hold this cup of coffee and test your muscle. And if you're weaker, okay, coffee isn't good for you. I've seen it used that way. In this way, we're using it from an emotional standpoint. So we're basically saying, you say an emotional statement and the muscle gets weaker. And that's something that's in you, that's an energy in you that indicates it's time to let it go. Does that make sense? Okay, and then what will usually happen is they'll gather all these patterns and they'll teach you how to repattern them. And you can do this at home. Okay? You needed to hear this today? Oh, I'm glad. I am. That's why I'm here. Sometimes these topics are a little out there, and they're a little bit different, and I never know how people will respond. So I'm really glad you needed to hear it. And I hope you'll take from it some positivity, that we fully have control over how we interpret information and how we stay well, 100%. I think a lot of the times we're so easy to blame, or we're easy to blame others and blame our pain, when really we have the control to change that. We have the control to change the outcome in many cases and most cases. So the ultimate goal of this repatterning is to address all the imbalances in your body, physical, mental, emotional, and overcome certain conditions. Now, some of the most common conditions that I've seen used, that this therapy has been used in, addiction. So smoking addiction, alcohol addiction, drug addiction, this can become very, very handy with, because most of the time those outlets are being used due to some sort of pattern, trauma, some sort of outlet that the body has been resonated to be frequent with. Now, and it's funny, you said some people become smokers and some people don't, right? It was funny, my family, my dad and my grandpa were big smokers. Cigarette smokers, and I grew up around that, and I thought that maybe that's why I never became a smoker, but I remember I was in theater in college, and I was cast in a role that required smoking, and the director said, well, are you willing to smoke on stage during the performance? And I said, well, sure, I guess, I'm not really interested in it, but literally it was all I could do to even do that. It's like my energy was like, I don't want it. I don't even want to go near it. I have no interest in it. So there was some sort of my frequency that just didn't allow me to go there. Now, other people in addiction, their bodies lean towards certain things, and that's what they are gravitated toward. That's their energy. So this can be very helpful in addictive patterns. This could go for addictive eating, smoking, drugs, alcohol, gambling. I mean, anything that you could really be addicted to, right? Allergies. Oddly enough, allergies and asthma have a lot of links to emotional, blockages. I know that sounds crazy, but true. Chronic diseases, of course, would make a difference. Depression, anxiety, insomnia, those types of things often linked to emotional blockages. Headaches, chronic headaches you can't find cause for. High blood pressure, also very commonly a result of this, and definitely pain. Okay? Any type of emotional pain can cause physical pain. Okay? And there's so many more. Okay? So a lot of practitioners can do sessions by phone. So if you look at the list that I have of the certified practitioner directory and there isn't someone in your area, usually they can get you started by virtual consults as well. So this is just something to look into. And even if you're not experiencing a lot of physical symptoms, I think we all harbor energy and stress that needs to be cleared somewhat regularly. I've used Reiki more so than resonance repatterning. I did have a repatterning session many years ago when I first heard about it because I wanted to see what it was about. I do think it was helpful, and I think it helped me kind of come into tune with what I need to let go and what I need to hopefully not hang on to, but there's certain things you kind of have to hold on to. I've had an emotional asthma attack. Yep, absolutely. Let me go back to some of these questions. You've heard about it for horses and dogs. You mean repatterning? I believe that for sure. But I don't have any experience in that one. Do you agree there might be a difference between healthy and unhealthy organ vibrations? May vibrations of a healthy organ treat an unhealthy organ, reset the unhealthy vibrations? Well, that's kind of what this is based off of. It's saying that this energy and these resonance, these patterns are linked to certain organs. And so having an energy imbalance in those organs, this is based off physics, right, would cause a problem. So by resetting that can actually, the theory is that you can actually reverse disease. Now, like I said, there's so many factors to this. Obviously, everyone's at a different point in their health spectrum. Sometimes you do also need additional therapy, but it can't hurt to look at that connection between the emotional and the physical and clear that so that that's not a limitation to healing. In naturopathic medicine, one of the things that we state is in order for somebody to be well, you have to, what we say is remove the obstacle to cure. So if you're trying to go down a certain street and there's a roadblock, it doesn't really matter what you do, you're going to keep hitting the roadblock. You have to remove the block or find an alternate way to get to your destination. And I think our body is very similar to that. You can fight. A lot of times we fight a symptom by just throwing a bunch of medication at it, and we don't think about why is that symptom there? How did we get here? Is there a detour? Is there something in the body that's causing a block? And could that block be both physical and or emotional? A lot of the times we don't address the emotional component of the physical symptom, if that makes sense. So always looking at how to remove the obstacle to cure is really important, right? You guys following? You with me? Well, what up, handsome? How's Norway, Fred? Good to see you. Always nice to see friendly faces. Mary, they call it emotional baggage for a reason. Yeah. And it's not always this long-term trauma emotional baggage either. It could just be the energy in the world right now, which stinks, right? There's many of us trying not to make it stink, but it does, right? I see a lot of people just joining. You missed the meat of the topic. I hope that you go back and watch it from the beginning because I think it's definitely worth looking into, right? Do you guys agree? Will any of you look further into this therapy moving forward now that you've kind of heard about it? Good morning. Good morning. It's a busy morning. Happy Monday, everyone. So like I said, I do not, otherwise not bad. Good. The weather here in Arizona, oddly enough, it's cloudy this morning, which is beautiful here because we don't get that very often. And I'll say it's cooler in that it's like 100 degrees instead of 120 degrees, which is good, I guess. I'm actually wearing some jeans today, which is like unheard of in the summer. So, all right, well, any more questions? Let's see. I had foot pain for a while and I just recently it went away. I think I cleared something. Yeah, so this therapy would depend on the physics of your body, the exchanging of energy, right? So a lot of the times that energy gets tracked. Now we've talked about TCM and acupuncture, I believe, and using meridians in Chinese medicine to clear energy. Similar type thing. All of these therapies kind of weave in and out of each other. But the bottom line is, if you're just joining, is that emotional pain can cause physical symptom, and physical symptom can cause emotional pain. And you have control over how you interpret the energy that's brought to you and the energy that you put back out. And if you put out negative energy, you're going to attract negative energy. That is the summary of this particular therapy. The goal is that you put out what you attract. You attract what you put out, right? So trying to change that energy field and focus on frequencies in your body that attract what you're actually trying to get can be not only successful in physical symptoms in your health, but also in general in your life. So hopefully this kind of opened the door to looking into resonance repatterning, looking into ways that you can continue to heal mind, body, and spirit. Thank you guys. I really appreciate all of your support. I will be back tomorrow at my usual time. I have a couple great topics coming up this week. I am going to talk about oregano. I know that's been requested. That will probably be tomorrow. If it's not tomorrow, it'll be Wednesday. I promise it's on the list. And then I probably will also have a Q&A this week. So start getting those questions ready. And I want you all to go out, make this a great Monday. And I will see you guys tomorrow, same time. Much love to all of you. Take care of yourselves, and please send out some positive energy today. People need it. All right? Bye-bye now. Take care.